Welcome to week two of Know My Disability, brought to you by the MVCPD, the New Brunswick Coalition of Persons with Disabilities, la Coalition des Personnes Handicapées du Nouveau-Brunswick. The MVCPD believes that to be successful, an advocacy group must use all the colors in the box of crayons in order to get a clear and accurate picture. This is why we represent all disabilities, the visible, invisible, and mental health. For the next little while, we will be helping you to know and understand some of these disabilities. Welcome to week 2 in review. What is spina bifida and hydrocephalus? Spina bifida is a condition that affects the spine and usually is apparent at birth. It is a type of neural tube defect, or NTD. It can happen anywhere along the spine if the neural tube does not close all the way. It has a wide range of symptoms, including problems with movement, bladder and bowel, and problems associated with hydrocephalus, or excessive fluid on the brain. The severity of symptoms varies considerably, depending on the location of the gap in the spine. Like most disabilities, there is no cure for spina bifida. The best practice is to have a good medical team and work closely with them to best manage the problems associated with SP. Global Development Delay, or GDD, is an umbrella term used when children have delays in both their cognitive and physical developments. They must have delays in at least 2 of the following areas: motor skills, speech, cognitive skills, social and/or development delays. It will continue into adulthood as developmental disability and is often referred to as autism, ADD, ADHD, and/or FASD. As well, adults with rare illnesses such as Angelman or Pitt-Hopkins syndrome are labeled as GDD. This condition affects every aspect of your life and presents itself in many different ways, often with an IQ below 70, which will make school and work difficult. They have trouble adapting to daily rules and expectations of daily activities. This is why early intervention strategies are critical, which means that access to family doctors and specialists is just as critical. These early strategies include but are not limited to occupational therapy, speech therapy, physical therapy, audiology, and psychological and behavior therapies. It is also vital that school personnel be trained to work with students with GDD and have access to all the tools and services required for students to progress. Ultimately, treatment of GDD is not possible, but you can continue to work on treating and improving the underlying symptoms. It's a learning disability that causes difficulty with motor, visual, spatial, and social skills. Children with MVLD are often well-spoken and can write well, but struggle with subtle social cues and comprehension of abstract concepts. So in other words, things are often in black and white. They do not see those shades of gray. Depending on the person's unique challenges and strengths, as well as their age, and different approaches can be tried. There's no one solution and no one-size-fits-all resolution. Students who are diagnosed early are often taught various coping strategies, but strategies are not a cure. They're just a stepping stone or an aid. Adults not diagnosed as a child often struggle to even get a diagnosis and are often mislabeled as having ADHD or, worse than that, called lazy. Adults, like children, will require accommodations to work and will need to continue working on adaptation strategies. Retinitis pigmentosa, or RP, is a group of rare eye diseases that affect the retina, which is the light-sensitive layer of tissue in the back of the eye. RP makes the cells in the retina break down slowly over time, causing vision loss. Often, symptoms start in childhood with a loss of night vision and peripheral vision, and eventually most lose all sight. Symptoms will start in their youth, with the child being unable to see in the dark or have their eyes adjust to dim light, as well as the loss of their peripheral vision or the ability to see out of the corner of their eyes. They will often experience a hard time reading print, a hard time figuring out detailed images, tripping over unseen objects, and glare can be a real issue. There is no cure or treatment for RP. However, there are low vision aids and rehabilitation programs for persons with RP. However, this means that they must have access to those aids and those programs. Wearing UV sunglasses can help delay the onset of the progression of the disorder. But again, when you're on social assistance disability with minimal income, that's not always possible. Friedreich's ataxia, or FA, is a rare inherited degenerative disease which is a defect in the gene called FXN. It damages the spinal cord, peripheral nerves, and the cerebellum portion of the brain. This condition tends to develop in children and teens and gradually worsens over time. Unsteady, awkward movements and a loss of sensation due to nerve injury develop as the disease progresses. There is no cure for FA, but some potentially breakthrough treatments are under study. Treatments focus on minimizing symptoms and maintaining comfort and function for as long as possible. Options include braces to bolster arms, legs, feet, or spine, physical therapy, speech therapy, occupational therapy, and surgery to correct skeletal problems. Medications might be required if heart problems or diabetes develop.